to all revered gurus. I surrender to all revered gurus and esteemed guests present here today. It's my privilege to welcome our distinguished guest organizers and our passionate audience to today's session. Now, I would love to introduce about our Team Ayuryana. Team Ayuryana is a holistic platform that brings together diverse activities.
Megha, you are not audible. Paripurna, you continue.
Recreational activity and exertion for students, individual with physical challenges, seniors, and general public. Sustainable tourism programs such as ecotourism and agritourism. Ayuryana proudly blend tradition with innovation. Events and activities incorporate traditional practices, local cuisine, and rural dreams. Ayuryana, inspired by timeless principle of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a very rich tapestry of heritage and wellness. There is an exciting announcement from Team Ayuryana. I request Dr. Radha ma'am to share the same.
Om Dhanvantri Namaha. Namaste all. I heartily welcome you all to our webinar series on Ayurveda practice. So we are conducting 2 days residential workshop on 24th and 25th May at Sara Center, Batte This is our second workshop on Ayurveda practice. So the session includes 8 sessions. We conduct 8 sessions. These sessions, in that sessions, the speakers going to share their decades of experience, and they guide us to apply Samhita into practice. Discussion on doshas will be there, Ayurveda cardiology, and lifestyle disorders with and like treatment with and without panchakarma, Ayurveda cardiology, emergency care in Ayurveda. So many more such interesting sessions and activities will be there. All UGs, PGs, and even the practitioners can register here. So we take only limited seats. So here the schedules are mentioned. So we take only limited seats. So register soon. And this is there. WhatsApp group will be there. If you are not in the WhatsApp group, like just comment in the comment box workshop. So we'll add for that. So the limited seats are there. Register soon, and you join us for the enlightening journey. Thank you.
Thank you, ma'am. Now I request Dr. Paripurna sir, who is pursuing his PG from NIA Jaipur in the Department of Samhita and Siddhanta. Welcome, sir, and please introduce about our today's esteemed speaker.
Thank you, Dr. Meghana. It's my privilege and honor to introduce our today's guest, Dr. Dayananda sir, a highly seasoned and self-motivated professional with more than 23 years of hands-on teaching, consulting, and training experience, along with possessing excellent administrative, communicative, interpersonal skills. Sir has completed his BAMS from Kuvempu University in 1998 and post-graduation in Kaya Chikitsa from Rajiv Gandhi University of Health Sciences in 2007. Sir's recent assignment was being professor in the Department of Kriya Sharira with Sri S.B. Siddhalinga Shivacharya Swamiji, Ayurvedic Medical College and Hospital, Mundargi, Karnataka. Sir is brand ambassador for Mahisutra and advisor for Dr. Ural's Varicose Care Center and visiting cancer consultant at Sriranga Ayurveda Chikitsa Mandir, Mysore. Sir has extensively traveled in Karnataka, Kerala, UP, and Tamil Nadu for the promotion of Ayurveda through consultation, TV programs, guest lectures, online seminars, workshops, etc. Sir is regular online blogs writer. Sir has published articles globally on Ayurveda and effectiveness. Sir has specialized in Kerala methods of Panchakarma treatment. Sir has worked as resource person for developing Ayurveda clinical and pharmacy software. Sir has trained under Vaidya PMS Ravindranath Puntotam tradition of treatments, learned diagnosing and treating acute and chronic cases with different kinds of poisonous creatures. Fly for training has helped him to train student community and educate foreign visitors about Ayurveda. Being head of department has experience in managing team, planning, organizing, coordinating and budgeting, etc. Sir has worked in different capacities as lecturer, reader, associate professor and professor in different notable educational institutes. He is a good academician, physician, and has good success rate in treating chronic disorders like oncology condition, gallstones, varicose veins, skin, and other disorders. Sir has attended a number of workshops, seminars like national level certificate course on varicose vein conducted by Ayurveda, etc. Sir was speaker on topic scope and opportunities for BAMS graduates conducted by Prakriti Ayurveda Pratishthan, Mysore, and on rational view cancer in Ayurveda. It's my privilege and honor to introduce our today's guest. Let's embark this journey together, exploring the ancient wisdom of Ayurveda and its relevance in modern times. I request audience to drop your doubts in the chat box. Sir will clear your doubts at the end of the session. Sir, I once again welcome you, sir. The mic is yours.
Sir, excuse me, sir. Sir, mute ಅಲ್ಲಿದೆ sir.
No, Nutarila.
It's audible now, sir. It's audible.
Yeah. First of all, I would like to thank Ayuryana team to think this platform will be the useful and their effort in making the bringing the experts or the expertise in the field of Ayurveda to introduce them to the beginners in this field to say that there is a path which all of us can travel in our own science which we have studied for so far, and we can believe that this science is also working, or we can have our livelihood and contribute whatever is possible to this science. So let me start with the presentation. It's relating to the Lord Dhanvantri. We will start the sessions. If anybody has a question in between, please welcome, because it will be easier. Or at the end of the session also, it's welcome for me. No issues. First of all, I would like to salute my pranamas to the Vaidya Ravindranath, who is the chief physician and founder in Pundatam Ayurveda Ashram. And then second, Avanapuram Vishwaran Namboodiripad. He is no more, but he used to be a physician for elephant, and he used to treat poisonous cases like any poisonous creature, including the snake bites. He was a person who was authentic, or whose certificate was authentic to get the donation of elephants for Guruvayur temple. And Yogesh Bindalasya, I think most of you know him. He's from Pune, from where I got the intuition that we can treat cancer. So today's topic, cancer care in Ayurveda, which is so generally when we see the crab, which always shows that cancer and the crab goes together. Most of the time we think that what is the relevance? Just thought of giving a hint on that. Medically, the word carcinus refer to the crab, where the legs of multiple fingers are the legs which you can see the crab. It can move into any direction. The crab, similarly, the cancer can spread to any direction. This is what I meant with that. And then astrologically, the stars looks like the cluster of the crab. That's why it's called cancer. There's nothing relevance that the person with the cancer zodiac sign will get the cancer, but this is how it is there. Looking at the characters, I think all of you know that the cancer is abnormal cells and uncontrolled division which is happening, and they can infiltrate and destroy any abnormal tissues. It can start anywhere and often an ability to spread anywhere. This, I think all of you know this. Coming to the mechanism, is the modern says there are three mechanisms which basically are pathology, or where we can see that how the disease can manifest because of the failure of these three mechanisms. First one is protocongens, where stimulate the production of the cells. There is always the requirement of the cells as the self-destruction is happening. That is where the cells has to die after the certain period. For example, RBC has to die after 3 months or 1 to 2 days. That is apoptosis. So if it is happening, there should be some cells to replace that immediately. That cannot happen overnight. So that has to be planned. So some tissues need to be, or some cells to be replaced every day. Some has to be periodically, but this calculation is done by prontocogens. If that calculation misses, then there will be overproductions. Then tumor suppression genes will control. Even there is a stimulation, it tries to control how much it is required. If it is in excess, that is will get destroyed. Or if there is an abnormal cells produced because of repeated production, or there is a urgency in producing the cells, then this type of particular cells later, which will not be able to perform its normal function, so it will be destroyed. And the last one is the immune system. It governs all those things. If the fetal cancer has to happen as per the modern, it has to cross all these, or it has to bypass these stages. Generally, we can see that it's like driving a vehicle. Protocongens is like an fuel. How much you put the increase the accelerator, that much the vehicle will go. But you can control that with the brake. Sometimes it goes beyond the control where the vehicle cannot be stopped. There the accident happens. Similarly, these two are there, but there isn't power to the driver who can control, who are capable. Because some of us know that who are able to drive rash, but they have control. But other people who see it is rash. But in this case, the body can take care, but not always. And the fourth one is depend on the road. This is what I feel like. Although there is vehicle, there is a good driver, there is good fuel, but if the road are bad, it can lead to the damage. This road is what we see in Ayurveda as lifestyle, which is basically ahara, vihara, and sadrut. So even though the person is healthy, but later on, if he indulges in ahara, vihara, which is not favorable, and he is not doing sadrut, definitely will end up in other type of diseases, but cancer also. We know this proverb, like we are what we eat. So when we eat hybrid food, how can we expect the things to be more stable? Or the word hybrid, it says that yielding more or bigger size. When we say we are what we eat, like the other way, ahara sadeya sambhava. So we eat something which can stimulate the cells to be in a bigger size and more quantity. So that itself is stimulating the production of the cells. GM and modified food, this is fortunately not in India. You can see in the cotton and other thing it came up, but it's not no more. This is something good which you can see. Most of the time I go with this word. When we eat seedless, we go seedless. That's why nowadays we are getting the IVF center increasing everywhere, because seeds are not potent, because we don't eat something which can give the seeds. Similarly, the fast food, the milk, pasteurized or fertilizers, and the hybrid trees are the plant which you can see that they grow smaller, easy to harvest, they're protected with the they can protect themselves from the insects. Look, you need to create something, there will be always imbalance. The lastly, which you see the storage in the freeze, which will keep everything which is tamasika food. That will lead to the tamas in the nature, gurutva in the nature to the body. And the way we cook Here, I just go it really quickly. We use the polymers or the utensils which are in the plastic, which leads to the absorption or involvement of those chemicals into the food which we eat. Later on, that will lead to the diseases. Similarly, the processed food which we eat. Anything which we process is a processing food is a process where something is added to make it much more presentable, crispy, or more cleaner. So that chemical, that process will add up some or leave some chemicals to that particular meat or the food, which will not be able to separate later on, which we forcibly eat it without knowledge. Definitely, those things will lead to the diseases. And most of the time, I compare these two things. Like when I want to blend something, when you want to fill your stomach, both are same. Once you start blending something till it finishes, we won't add any additional things except water. So what we eat should also be like that. But it's not happening. We drink something at 7 o'clock and then breakfast and then tea at 11 and then lunch and then snacks and then even the previous food has digested. Before that, we start eating something where the previous food has traveled to a half of the process. Then once you add something else, then the whole process of digestion is disturbed. That you can see in terms of juicer or the mixer. If you want to grind something, you add something till it grinds to the level we continue that. In between, if you add something, then the process will be hampered. You won't get that quality of grinding which you are supposed to get. So that means most of us we are doing this mistake. And as I told, the enzymes are added which are needed to process the food while the food is consumed. So we eat the food is different. The way we eat is also countable. And the stomach position, I think most of us know this, that after the meal, we should be in the left lateral position, where we can see that when we are in left lateral position, both the orifices are stretched so that it's closed. We don't have regurgitation. The fundus is reduced so that the gases which will go out, and we have maximum gastric juice secretion glands in the fundus area or the larger curvature of the stomach, which will not touch the food if you are in a sitting position. Most of us we don't do. Then the food will not digest properly. If you're looking at the intrinsic factor which is responsible for identifying the vitamin B12 and absorption, if that is not absorbed, that is lead to the GI malignancies. And if you are able to sleep in left lateral position itself is giving a stimulation to absorb or increase the absorption in the system. Similarly, you can see that when there is an persistent anemia, that will lead to the immune system to attack the healthy cells. That is, once again, it becomes a risk of developing the cancer, especially of the stomach cancer. And the activity, we have become like reverse. The day and night has become one. So we feel that night is more comfortable. So we try to do a lot of things in the night rather than in the day. The day should be passive, that we've forgotten. So usually when we look at this, early birds are optimism, satisfaction, and carefulness. These are the more positive things which you develop by dinacharya and ritucharya. If you are opposite to that, then you are depression, negative, and neurotic behavior. So these things will lead to the modifications in, once again, dinacharya, ritucharya, and sadruta, which will lead to the diseases. And activity and cosmetic environment, you can see that we are almost sedentary work. So sedentary work, if you look our body, the legs, we have almost half of our body. We don't use them. We get into the car, go, come back, sit, or the vehicle. We don't use them. So when you don't use them, there is always a problem which happens. We need to look at the cosmetics, chemicals, and then pollution, which you can see, which is leading to the multiple causes. Vitamin D is very simple thing, which is a required minimum, but most of us are lacking because we don't expose ourselves to the sunlight. And vitamin D, though it is required in less quantity, but if it is reduced, we have a lot of complications, including behavioral changes and degenerative changes. Looking at the cancer pathology, the microenvironment which is required to influence the cells, because whatever we eat will not just lead to the diseases. As we know, it has to go through the Shatkriya Kala. So that Shatkriya Kala will create a favorable environment where disease can manifest. So for that, influence the normal cells, molecules, and then the blood vessels formation, and then it begins to the metastatic condition or spread to the different parts of the body. So that we can see in case of Kriya Kala, which is mentioned. In case of Rutu Kriya Kala, we can see that Chaya Prabha Prashamana is there, but Vyadhi Kriya Kala, Prasara Stanasamcha Vyakti Bheda is there. Difference in these two is when you are following Sadruta, though the Prakopa happens, naturally the climate or the universe as well as the food habits which you do according to the Rutu will make the Prashamana of that Prakopita doshas. If not, that will lead to the diseases or a pathological state, I can say that. So this microenvironment, we can say it is a sakala or a harmony or disharmony. For example, to say that in rainy season, not only the rain is sufficient to grow the plants, the whole atmospheric temperature changes, weather condition changes, that itself will make a favorable condition and the rain is added up. If you're creating the same favorable situation in summer and we can't grow the same type of plants. So because that environment which is required is the basic thing which helps for the formation or stimulation of that production. In case of Ukta and Anukta Vaidis, Ukta means something which we can see that already existed or explained in the text. We have Nidana, Prarupa, Lakshana, Upashaya, Upashaya, and those things. Anukta is which are not available. That means it's not available means it's not explained. No, it is explained. We need to find out the Nidanas from the different source as well as Chikisa Sutra from the different source. In that, cancer is one such disease which we can see that direct references are very less. We need to find out our own way. Arbuda, for example, to say that most of us know that Arbuda is cancer, but let's take it to grant for time being. Later on, we can discuss on that. Different concepts of Garbha, skin layer, Mamsaruddhi, Dhatuvata Sleshma, Madhura Rasa, and in case of diseases, Vata Rakta, Upadrava, Gulma, Shofa, Granthi, Arbuda, we see that the Arbuda, these explanations are seen here. Just we'll go through that quickly. In case of Garbha, we can see that formation of Garbha, when in the second month, it is told that if it is the shape which is of different nature will lead to the either male or female, or if it is Arbudavat, it is Ghana and it doesn't have any birth. So the examples are given like it is Shalmoli Muklot. And then Hindu it says that Pariruttam. Chakravarti says Ruttam Unnatam. Here also we can see that it's not explained as it is. There are different views because it is manifesting each time with a different presentation. There is no one standard presentation. Is there that Jara is Santapa, Gulma is this one, or Rana. It is not seen. So it is always changing. So the different authors have different views, which we can see that improper shape and the structure is the nature of Arbuda. And in case of layers of skin, you can see that there are 6 layers. I think all of you know that. In Rohini, the word Rohini means ascending. The diseases like Granthi, Arbuda, Apachi, Shlipada, and Galaganda, where the Ruddhi or the increase in the volume or Sthiratas, which we can see that in the diseases, is ascending or it is the base is the 6th layer, that is the Rohini. So we can say that it is a layer where the growth can happen. In case of Dhatugata Sleshma, you can say that when Mamsa, in Mamsa, if the Sleshma is accumulated, that will lead to Arbuda and Apachi. Similarly, in Mamsa Ruddhi, we can see that Mamsam Ganda Arbuda Granthi. So when Mamsa Ruddhi happens, Arbuda is a outcome of that. So Shleshma is Prithvi plus Up Mahabhuta, that is increased. But you can see that usually when we say Shleshma, we say Up and Prithvi. But in the disease formation here, you can say that the kapha is becoming more ghana and stable, and it has not the Shleshma functions. It started doing the Vikrita kapha function where the Sthiratva will be more or Dravatva will be more. And in case of Rasadhatu and Arbuda, you can see that when somebody has more or excess of Madhura Rasa, that will lead to Gala Arbuda. It is excess of Madhura Rasa is Shleshma, and then Shleshma, that is lead to Dhaturuddhi, Staulya, like that Agni, Sada, and leading into the Arbuda or Gandama. In case of disease, you can see that in Vatarakta it is told that Tridoshat, but Sravi Stabdam Arbudakari. That nature is there, then we need to say that it is Asadhya and we need to leave. Here we can see that Arbudam Sthiram, Ghanam, Srava. So these are the nature we can see that in cancerous condition, some of the where the open wound is there or lesion is there, we can see this. The margins are very hard and then rough. There is no healing process. Granulation tissue be very less. So that we can compare to this condition here. So Arbuda, we can say that bleeding ulcers are non-healing ulcers. Gulma, I don't go with this as a 100% thing, but there are nature which can happen because Gulma is something which happens in a particular area. It is Basti and Hridaya between it has to happen. It should move and it should be increasing and reducing. Chaya Upachaya will be there. That is not happening. But there is a reference where the Gulma can happen in the Bahya Roga Marga also. So not only in the GIT, in Bahya Roga Marga also. So this nature which can happen in the Bahya Roga Marga might lead to the cancerous nature. Looking into Shofa, I think all of you know this. Here, when you come to the hard Shofa, it is Granthi and Arbuda is explained. This is how we get the more Samprapti, like Shofa is the base for many diseases, and then it is the basic foundation for Arbuda and Granthi. The Granthi, which you can see that it is capsulated. I think all of you know that that's in tumor and the cancers, where Granthi is capsulated and it grows. It creates problems because of increased volume and the pressure which is creating on the adjacent organs or the parts of the body. If you're taking Arbuda, the word Arbuda, which is comes as in himsayam, that can hurt or kill a person, the basic meaning. And then if you see that in terms of numbers, counting the numbers, it is denoting that 100 crores. That means when somebody say Arbuda, it is 100 crores itself. That means the cells quantity you can see at the number should be more than the normal requirement of the body. So together we can say that which can grow in 100 crores and which can harm the body. Together we can conclude that which is almost similar to the nature of the cancer which we can see nowadays. In standard Granthi, all of you studied this Arbuda in case of Sushruta in the final year. So it is saying that Mamsa Pradushata will be happen. But before we saw that Mamsa where Kapha is involved or Kapha Sanchaya or Kapha will become Sthana Samchaya in Mamsa that will lead into the Arbuda. But nature later what happens is its nature is Ruttam, Sthiram, Mandarujam. It will be very less pain. In cancerous patients, we see that most of the time it is found out accidentally while doing something, or there is a mild pain here, but the person doesn't go to the doctor. After a long period, when you go, it is already manifested into a big disease. It is Mahantam Analpamulam. It is huge, but the roots are much more deeper, not less roots. That's why we see that metastasis happens from one to the other region also, which we don't notice how it has happened, why it has happened like that. And is Chiraruddhi apakam. It gradually grows, but it is apakam. Once it is paka, like vidridi, then the body able to take care. But since it is apaka, we can compare this to the apoptosis, where the cell destruction will not happen. This also can be included here. And especially it says that mamsa upacheta shofam. That means the most of the references say that when there is an upachaya or sleshma accumulated in mamsa is the main reason which we can see that the arbuda can manifest. Looking at the basic principles of cancer, just a hint, all the biological functions has to undergo or mandatory that this has to be there. That is regulative, constructive, destructive. So something has to be produced and maintained and destroyed. It's a natural law. I think all of you know that. Similarly, sthiti utpatti vinasheshu bhuthanamesha karanam. What is that? You can see that sthiti, maintenance, utpatti, production, and vinash. Totally the control of something is born, maintained, and destructed. That is the vata karma. So we can see that the dosha which is getting involved mainly is vata. When you're looking at the akupita vata karma, it says that dosha dhatvagni samadaha. That is, it makes the dosha dhatu into a normal distribution, function, everything. We can say that. So we see that dosha dhatu malamulami sharir. So these things are maintained. That is, the quality of sharira is maintained. And then coming later, samprapti vishesh. It has the capacity to perceive, and then that is perception, and then later on it says the kriya, that is karmendriya. You can see that it is responsible of ubhayendriyas, dhanendriya, karmendriya. You can see that the sensation, the identifying of the cells, controlling the production and maintaining the system is done by vata. And anulomana. Anulomana means most of us think that apanavata andam. No. It is normal functioning of the particular dosha in its own direction. For example, to say that udana has to move up and prana has to come in. But if this varies, that will lead to the difficulties. So anulomana is not just downward movement. The karma which is done to be optimized in a normal pathway. So if you're looking at this is the basic things which can alter, lead to the multiple diseases, but definitely we have seen that most of the cases, these are the issues which are noticed when they are doing the nidana. In case of Panchamahabhuta and Garbha Utpatti, you can see that Vayum Vibhajiti. So cell division has to be with the consent of Vata. So along with Pitta, definitely it is there. It's not 100% Vata because the heat will always help to break when there is a force. We're looking at the Srotas formation. When Ushnata of the Pitta and Vata increases together, that will lead to Urdu other Tiriyak Srotas. That means you can think that this is how the spreading happens. New channels are created to a mass where the blood starts streaming out. So if you try to control Pitta Vata in this situation, that we can say that further growth of the cancer cells can be avoided or metastasis can be controlled. Role of Manas is very important, which we're seeing in these cases, like Manas is involved in the origin of diseases. I think all of us know this. This is starts with Ashtanga, the first Loka Raga Adiroga, which you can see that. And Prajna Parada, you can see that the Dhruti Smriti Vibramsham. That is how Prajna Parada it starts. So that means Manas is involved. Manas is one which is required for Bandha Moksha. To attach with the causative factor of a disease, causative factor for the cancer is Bandha. If you leave it, it is Mukta. So if you make a mind, it is attached or detached. So how long you continue with that nidana, which can lead to the particular cancer, or in between it is disrupted, cancer is not manifested. And then manas is nourished by the rasadhatu. So if the whatever the food if you're eating, if it is not proper, then manas will not be nourished. That will lead to the insulin, the like a deficiency of vitamins, deficiency will be there for the manas. In case of Roga and Padani Adhyaya, you can see that not following Manasika or Sharirika Vega, Dharana or Dharaniya Vegas, everything will lead to Vata Prakopa. Most of us, we do this nowadays, which increases Vata in the system. As we discussed in case of Anukta Valley, so fundamentally to understand them, we need to know the Samprapti. That is, Parikshitam Estu Khalu Prayojanam Pratipatti Gnana. So we need to have that knowledge to examine the things to see that what is involved in the process of Samprapti that is helping us. Looking at the tentative conclusion, nowadays, imaging and biochemistry are mandatory for the diagnosis of cancer. According to Ayurveda also, because we are not able to identify the cancer as such without the help of biochemistry and imaging. Imaging helps us to know the staging, and biochemistry also knows to diagnosis and staging. But if you are thorough with the treatment, with your thorough with the Nidana Panchakas, you can identify, because normally the diseases which are told in Ayurveda have particular Nidana, Samprapti, and if you look at the Samprapti Vigatana, we can come to a conclusion. Once the Samprapti Vigatana is done, then the Chikitsa is more easy. Our Chikitsa will fall into this, like Sukhasadhya and those things, which is, all of you know that. In that case, you know that what to treat. If that is not happening, the results are not getting. Something abnormal is seen where normal medicines are not helping them. If you think a little bit beyond the out of the box, then you can try to diagnose. It is possible. Understanding image and biochemistry is not enough for us. We need to convert them into the transcriptive mode of Ayurveda. We need to digest through the Ayurveda, then only we are able to get the results. So always I request the beginners or the learners or including me to think, visualize and perceive only through Ayurveda. Cancer might be Arbuda alone, it may be Asadhyarana or Upadrava of a disease. In that, we need to take the consideration of Ashraya Samadhi. This is very important to know that how the cancer spreads to the different parts of the body. Why that organ only? Why not to the other organ? There is always a pattern. So we can see that dosha with dosha, upadhatu, kala, shrotas, avayava is always there is a link. So if you're looking at the dhatu utpatti, you can get an idea. In case of Rukka, you can say that Rakta Meda Prasadam. So when there is an involvement of Rakta and Meda, Rukka are involved. If there is a blood cancer, there is a possibility of getting the renal diseases. Adipose, then once again. Similarly, Ekratplia or Shonita, any blood-borne diseases definitely affect these things. So like that, if you look at that with what they are formed, what is the basic component, will have similar affinity towards the similar. So if any abnormalities, it will go to there first. In case of Pupusa and Mamsa, I can say that it is Shonita Phaneja, it is there. So in case of Urakshata, there is always the Balakshaya, Mamsakshaya, which you can see in Rajayaksha also. There is an article which is published saying that the people who undergo bypass surgery, they are losing weight, but without any reason. You can say that Urakshata, which is happening, we study that when there is Urakshata, that will lead to the body weight loss. So this is evident, it is there, but they don't have the link to prove. So once again, we can take to conclusion, we can say that it can be a specific condition, disease, organ specific stage of any disease as per Ayurveda. Little common factor if you're looking at them. Tesham Kshaya Ruddhi Shonitamitam. So blood quality will decide the Ruddhi and Kshaya of the body. And Arbuda can be of Raktaja and also the Medaja. Bahya Roga Marga, the Arbuda is explained. So this will give an tentative idea that where and how or what are the factors which are involved behind. Tumor cells and is tumor or cancer is not a disease. For the modern, yes, but for the Ayurveda, it is more towards the tendency. There is sakala. If there is a sakala, then only the growth happens. Otherwise, the growth will not happen. But growth as well as the tendency are important because once the growth happens, it goes to the surgery case once it is done. But to nullify the sakala, we need the Ayurveda treatments to take care of that. All of you know this two definitions. Chiyete anadavitikaya, shiryate aniti sharira. If you look at this, the whole life, these two things are happening continuously. Cells formation and destruction. If cells formation is more, cell destruction is less, that is due to the cancer. So basically, this physiological function is hampered where the production of the cells will be abnormal. So looking at the medications, we can see that the method which we follow in our treatments are first one is preventive, the therapeutic, in that the treatment which goes avoid recurrence. There are patients who wanted to avoid the recurrence of the diseases, maybe the breast cancer or ovarian cancer. Then we try to help them up and support you to enhance the efficacy and synergism. So some people they will ask that they want to take the allopathic medicine, but they need help to support that so that their immunity is better. They can withstand that, and as well as in case of chemo radiation, they can reduce the complications. And the fourth one is palliative, where we try to create an environment where the digestion or the agni try to be helpful or manifested or towards the normal, where they can eat better, sleep better. But mostly the medicines will not be curative. It's only the maintenance, you can say that. So in case of Ayurveda, it is the maximum scope in treating because as we're told what we eat, we are ahara, vihara and chadurtha and aushadha. Aushadha will come to the later stage. But initially, these three are the causative factor and these three are the treatmentive modules, which you can see in that. Generally, we go with Shamana, Shodhana and Shastra, but sometimes when there is a cancer, which is of bigger size and volume, better it goes to the Shastra and then come to the this one. But if somebody is going for the operation, still you have the time, Bala, better to undergo the Shodhana and then go to the operation. We have seen that the recovery is much faster. Rasayana is the other thing which is required to increase the ojas, dhatu portion. And we can see this Roga Paranam. This most of the time we forget. Rasayana means most of the time we think that it will also increase the cancer cells. But you need to choose something which can be Roga Parana like Rasayana. Otherwise, it will definitely increase or nourish the cancer cells also. Looking at this chemo, radiation, and these things, we consider chemo as Snigdha Ushna and radiation as Ruksha Ushna. So when you are exposed to the Ushna Virya, Brahma, Glani, Sveda, Daha, and Ashupakita happens. That we can see in case of radiation. So Rasayana, is it an immunotherapy? That's always question mark because they try to give the immunity of the cells to fight. But the Rasayana or the immunity, which we can see that's outcome of health. Like Swastha is the outcome of Dosha Dhatu, Agni Sama and those things. Like that we can't buy that immediately. Nuclear medicine is also good, which is targeted cells, which can destroy the particular abnormal cells and help to protect the normal cells. This is also upcoming in case of thyroid cancer, melanomas, which is used. For our understanding, always we need to go with that Brahmanda and Pindanda concept as the whole body in the cell. Cancer is a disease which happened to a particular part of a cell, but still the whole Brahmanda, whole body is healthy. And one case of similar thing, Buddhi Sarvesham, you can see that the if you do or if you indulge in the similar nature of food and habits, lifestyle, that will add up to the cancer. If you go opposite to that, once again, it is controlling. That is giving that pathya. And Sakala, which we discussed before, that also Sakala is created by them and then Sakala is nullified. Sakala for health, Sakala for the disease. Both are controlled by Sakala. My teacher, Yogesh Bindara's famous word, this is the world I lost by focusing on only killing cancer. Because whenever we say cancer remedy, if somebody gives, the people think that he's giving something cancer killing cells. So nobody will think that cancer is a part, the whole body is remain. Of course, Sattva Chikitsa is required because Vishada Rogavardhanam, any disease can be increased if you are worried much. So Sattva Jaya, Pranayama, Sadhukta are required. And in case of Bheshja, we can see that it has to be given on a particular time, looking at the Nirama, Athuravastha, because its optimum is going to happen as per the Ritu. You can see here, in case of Vamana, it has to be given in the morning and Basti in the later on, Madhyana Kinchita, Varshita, like that. It has a specific thing. So if you want to treat in this way, the optimum benefits, you can see that. Rather than thinking that one medicine will work forever, avastha changes, we need to keep on changing the medications. So in case of Alpabala, we are used to use Rasaushadis as Shodhana, Lekana, Shamana and Balya, because Rasaushadhi does all the things. Sometimes we use Hirakavasma in particular conditions, and then Kantaloha Basma, and then Tamra Basma, and Moktikavasma. Just have given a few examples here in the different contests. It doesn't mean that only these are used. You can go with the contest accordingly and use whatever the medications are available. There is a dark area which we need to explain is Agada Tantra. Is where the poison is there inside body, you're able to neutralize without harming the abnormal or normal cells. So there is a possibility if somebody can work on that. And we also always open-minded to accept analytic and analysis and methods to be used or used by other people. We are also able to open to discuss with them. I'm going to share few clinical experiences. Basti Karma, we can see that Ardha Chikitsa it is there and indicated to the all group that Bala, Ruddha. So if somebody is not contraindicated for Panchakarma, you can go with this Basti. And it reaches 3 Roga Marga, so it is easily helpful as it is a multi-dimensional formulations are 8, but it should be very careful when you're doing Basti as it controls Vata. If the proper procedure is not done, then it will lead to Prakopa of Vata also. In this case, you can see, you can listen to this case.
Like I decided I'll not go allopathy. Like I asked him for allopathy, radiation surgery. But I don't think I have that mental or physical energy to go through those processes. Because I decided ನಮ್ಮ Ayurveda ಅಥವಾ ನ್ಯಾಚುರಲ್ ಮೆಡಿಸಿನ್ ಮಾಡೋಣ ಅಂತ. ಸೊ ಆಗ ನಮ್ಮ ನೇಬರ್ಸ್ ಶ್ರೀರಂಗ ನಂಬರ್ ಕೊಟ್ಟು ಕಾಂಟ್ಯಾಕ್ಟೆಡ್ ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್ ದಯಾನಂದ ಅವ್ರನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ತಾ ಇದ್ದೀನಿ. ಸೊ ಡಿಸೆಂಬರಲ್ಲಿ ಹೇಳಿದ್ದು ಡಾಕ್ಟರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ರೆಗ್ಯುಲರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೋಗಿದ್ರೆ ಐ ಕೆನ್ ನಾಟ್ ಲಾಸ್ಟ್ ಬಿಯಾಂಡ್ 6 months ಅಂತ ಲಾಸ್ಟ್ ಈಗ ಸದ್ಯಕ್ಕೆ. ಸೊ ಆಯುರ್ವೇದದಲ್ಲಿ ಸಿರಪ್ ಮತ್ತೆ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಆ್ಯಂಡ್ ಪೌಡರ್ ಎಲ್ಲ ಕೊಡ್ತಿದ್ದಾರೆ ಸ್ಪೆಸಿಫಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗಿ. ಬಟ್ ಒನ್ ಥಿಂಗ್ ಐ ಶುಡ್ ಮೆನ್ಷನ್ ಹಿಯರ್ ಇಸ್ ಲಾಕ್ಡೌನಲ್ಲಿ ನಾನು ಊರಿಗೆ ಹೋಗಿದ್ದೆ. ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಐ ಫರ್ಗೆಟ್ ಐ ಆಮ್ ಅ ಪೇಷಂಟ್. ನಮ್ಮ ಫ್ರೆಂಡ್ ಒಬ್ರು ಬಂದಿದ್ರು, ಅವರಿಗೆ ನಮ್ಮ ಹಸುದು ಕರ್ನ ತೋರ್ಸಕ್ಕೆ ಹೋಗಿ ಕರ್ನ ಪೆಟ್ ಮಾಡಕ್ ಹೋಗಿ ಆ ಕರು ಗಾಬರಿ ಆಗಿ ರ್ಯಾನ್. ತುಂಬ ಹಗ್ಗ ಉದ್ದ ಇತ್ತು, ಹಗ್ಗ ನನ್ನ ಕೈಲಿ ಇತ್ತು. ಸೊ ಐ ಗಾಟ್ ಥ್ರೋನ್. the ಮೂರಡಿ ಅಷ್ಟು ದೂರಕ್ಕೆ I got thrown. I should mention that ನನಗೆ ಬೋನ್ ಕ್ಯಾನ್ಸರ್. ಬೀಳುವಾಗ ಯೋಚನೆ ಮಾಡಿದೆ ಆಯ್ತು ನಂದು ಅಂತ, ಬಿದ್ದ ಮೇಲೂ ಆಯ್ತು ಅಂತ ಯೋಚನೆ ಮಾಡಿದೆ, ಆಗ್ಲಿಕ್ಕಿಲ್ಲ ಅಂತ. ತಲೆ ಬಡ್ದೋಯ್ತು ನೆಲಕ್ಕೆ, ಅದು ಮಳೆ ಹೊಡೆದು ಹುಟ್ಟು ಬಿಸಿಲು ಬಂದು ಸಿಮೆಂಟ್ ತರ ಆಗಿತ್ತು, ಗಾರೆ ತರ ಆಗಿತ್ತು ನೆಲ. ಆಮೇಲೆ I just landed flat on the ground. ಲೆಫ್ಟ್ ಸೈಡ್ ತುಂಬ ಪೇನ್ ಆಯಿತು. I told I think it's over, multiple fracture ಅಂತ. So 1.5 to 2 minutes ಆದ್ಮೇಲೆ ನಾನೇ ಎದ್ದೆ. Slight fracture ಆಯಿತು ಲೆಫ್ಟ್ ರಿಬ್ ಅಲ್ಲಿ. Considering the fact that I'm a patient with bone cancer, ಅಷ್ಟು ದೊಡ್ಡ ಫಾಲ್ ಆಗಲಿ ಅಷ್ಟು ಚಿಕ್ಕ ಫ್ರಾಕ್ಚರ್ ಆಗಿದ್ರೆ it is one of the factors. The second is definitely the treatment. ಡಾಕ್ಟರ್ ದಯಾನಂದ ಅವರು ಗುಲ್ತಾ ಅಂತ ಒಂದು ಕೊಟ್ಟಿದ್ರು, ಅದು ವರ್ತಿಸ್ಲಿಕ್ಕೆ ಹಾಕಿದ್ರೆ ಬೋನ್ ಸ್ಟ್ರೆಂಥನಿಂಗ್ ಅಂದೆ. ಐ ಫೀಲ್ ಅದು ನಿಜವಾಗ್ಲೂ ವರ್ಕ್ ಆಗಿದೆ. ಇಟ್ ರಿಯಲಿ ಹೆಲ್ಪ್. ಅಪಾರ್ಟ್ ಫ್ರಮ್ ದಿಸ್ ನಾನು ಮಿಲ್ಲೆಟ್ ಡಯಟ್ ತಗೊಂಡು.
You can see here, this patient was breast cancer recurrence with the metastatic to the bones, which is especially on the ribs and the forearm, and in case of thigh also it was seen. So we were giving Tiktaka Grita Kshira. This is everybody's knows. This is not something secret, right? When you give Tiktaka Grita with Kshira, that will nourish the Asti. The same principle which we use, that is able to help to prevent the further spread of the cancer. So simple methods are easier to get the maximum benefits. We can see here also, it is a leukemia condition where they were given the medications. They got the pleural effusion, and the drug cannot be stopped. So they told that we need to take out the fluid, otherwise it will increase. So then the patient approached us. We could able to achieve that, nullifying the pleural effusion by giving lay pass to the chest region. Patient came for just that only. After that, they followed the allopathic, but still, we could able to have an intervention in between to help them during the cancers. It's an esophageal cancer where it was treated, and the condition is like this. With the histopathologically, it was squamous cell carcinoma. They had 6 cycles of chemo and radiation, which was showing the esophageal ulcer stage, which is not completely cured, and she has a difficulty in swallowing the things each time. She could able to eat only semi-solid food. Here you can see that the same patient, wall thickening with the SUV intake 5.1, and then circumferential thickening of luminal narrowing, and then you can see that 3 mm nodule, which is unlikely, non-specific in the lung. You can see here there is no growth. There is a nodule which was likely, but yes, nothing is seen. And the pleural effusion was mild here, but no pleural effusion. So the medicines were given is Guruchari Kashaya, Ragumalani Vasanta, Rasa Sindhura, Yaschimudu Kshira Kashaya, and Gugulutak Grita. Later on, we changed them to the sequentially. Grita was not given initially, but these are the group medicines we use. In case of Hodgkin's lymphoma, these were the symptoms which is a 21-year boy which we had. So you can see here that though the SUV intake is nil, but in the liver it was 1.9. Above 2 is positive. But 1.9, it was there, it can manifest. You can see that here, it is into like Prakopa and Prasaravastha. Vecta is once again then it becomes the disease which is manifesting. And you can see that after the 2 years of medication, there is nothing in the chest lesion. And LFT 22, it was alkaline phosphate as 124, and in 23, we were able to say it has come down. And in the abdominal scanning, there is no abnormalities which you can see. The medicines you use was Guruchari Kashaya, Guruchari Kashaya, Triphala with honey, Shiva Maika, Mukari. These were used in the different stages. This is one exceptional case which still we are treating and got a good result. It was a baby which we started the medication from 8th month 1 day. It was raised lefty and chronic liver ongoing cirrhosis, which we can see that the canvas formation was also hepatomegaly was there also, and we can see that it was leading the esophageal varices. So it was diagnosed and they were asked wait till they get a liver for the transplantation. So we took the day wise picture to see how this Shakashrita Kamala or Kostashrita Kamala, how we can analyze that. In that principle, we try to treat this case. So in 22nd days, almost we can see it is helping it out. You can see this also, like in the beginning days, it was like Tilapista Nivarcha, almost. I think we have seen this in obstructive jaundice or Shakashrita Kamala. Then 22nd days, the mala got the color. Similarly, you can see the eyes also, it is much better. So we could able to achieve this in that case where you can see that even the esophageal varices is also reduced because the pressure on the liver is reduced, water circulation increased, automatically the pressure on the esophagus is reduced where the esophageal varices is also reduced. The medicines were advised as Amrutatar Kashaya tab, Katurani Kota tab, Arogyavardhini Dashamarasayana is a combination of Somanati Tamra Visma and Hiraka Visma. But Panchapur of 1 to 50 ml with honey was given initially, and later on we started with these medications. And we kept on modifying these medications. There is one more lung case, lung CA, which you can see that I'm going a little fast as we're getting into the late. So you can see that previously it was 11.3 and now it is 10.2, and right lung SUV previously it was 10.2 and 1.4. It was 13. That means the activity has been reduced. This patient has took only Ayurveda. He was a yoga teacher and he decided not to go for allopathy. He's no more. But we could able to see the changes because most of the cases we can't ask them to do the PET CTs after some time because affordability is less. This is a review. I don't want to go with that. It's a submandibular with a mediasternal metastatic condition. We can see that FTG is likely the inflammatory, but here it's only the FTG intake is not there, but it's only inflammatory. You can see that. Hypermetabolic mediasternal lymph nodes are seen here, but you can see that nothing as persisting as such. This is a condition in breast CA. The patient was ER and PR positive and she was under the medication for that, and she had fatty liver. Fatty liver is a complication of the drug which is given for the ER and PR. So we could able to treat where there is no abnormality detected. In case of adenocarcinoma and cecum, sigmoid colon, and with lung metastasis, you can see that before the treatment it was 3.5 and it has become 3.1, and then lung nodules it was 8.1, it reduced to 1.2. Similarly, the hydronephrosis was seen, but later on it is no more it is seen. This is a patient where chemotherapy was advised and he was undergoing, but the vein slipped. The chemo medicines went to the subcutaneous area. It led to the condition which you can see. Immediately the patient came, we saw that condition like in Visarp, and we treated with Kashaya with Kshira Dhara initially, and then Kashaya, and then Grita Dhara later on. So you could see that changes. It has reduced. There is darkness which was remaining, but gradually it faded up. So my view of saying this is we can draw the samprapti of different diseases and apply as far we see the samprapti in a person. So it's not like cancer to be treated very separately. It is part of a Chikitsa Sutra. So we need to identify and draw them. And this is one condition where the goiter was supposed to get into cancerous condition. This was the when ultrasound and CTA was done, it was found out it is. So we given the medication of Gugulita Kashata, Boronadi, Gandamal Kandana, Shiva Gulika, Tifrachunavithani, and they like this. We went for a few days. And then we could see that this was the CT which was done. Only the growth will not indicate the cancer, but especially as I told, the microenvironment which is happening here, the adjacent lymph glands also started swelling or increasing the size. This gives a hint that there is some pathology which is happening beyond the normal physiology. It's not a simple goiter. It can turn to cancerous. So the precautions has to be made with the proper knowing the radiological investigations rather than just reading the whatever the results given. We need to go through the each and everything. You can see here, it was before treatment. How much difficulty he is facing to just swallow. You can see that face and then whole neck the movement. After 3 months of treatment, you can see how easily he will be able to drink. And you can look at the size also here. And there's one more case where oral CA, it was operated, but they had two finger mouth opening, which was quite difficult for them to eat food, and tiredness was there, and the body weighted is 10 kg after surgery because they're unable to eat. We give some medications, Gulita Kashaya, Guduchadi Kashaya, Lagumalini, Kavala was explained, and Shudangapani was given. After 14 days, they were able to chew properly without much pain. After 26 days, we could able to see that mouth opening is about 3 fingers. So stricture which has happened in the mucous membrane of the oral cavity because of the operation could also be released to a normal level with Kavala and Kandosha. In liver cancer, we can see that contribution of the gallstones is one of the risks which we can see nowadays. So we started treating the gallstone also here. In that, we could able to see that within a span of 9 months, the gallstone which was 10 reduced to 5 to 6, and then 2 to 3, and then it has become nil after 9 months. So if you are able to treat the pre-cancerous conditions or a condition which can lead to the cancer, you can prevent the cancer also here. And thank you for giving the opportunity once again. And if any questions are there, we can take it up.
Sure, sir, sure.
Is there any questions?
Yes, sir. There are few questions, sir, in chat box. Are they visible, sir?
No.
Yes, yes, sir.
Yeah, Navya, she's asking that Shodhana, yes, Rutu Shodhana, when you're not doing or not cleaning proper, yes, it can lead to the cancers. True. Mentioned as one of the nidans for the Shodhana. Yeah. Yeah, Ishwant. This is a sedentary lifestyle, contaminated air, water, and food. What are preventive measures we can advise for the people to prevent from the cancer? It is true that the world is becoming poisonous. As I told, preparing a food is one, and how to use it is a second one. So in this case, how you can prevent being there in that lifestyle is the thing. Otherwise, we need to find our own way to be in the forest or somewhere else individual. Practically, yes, we need to build up the capability of ourselves. When a cancer diagnosed patient comes to us, how to decide? That is what I was explaining, that if you are able to analyze, think beyond the box, and then try to find out the samprati, and you have the missiles, targeted bombs, or laser guided guns, like that, you have medicines, you need to use them as per your iti. So, this once again goes to the Sukhasadhya, Krichasadhya, Yapya, Anupakrama. You need to see where it is lying, how much you can help, and be frank with the patient. Don't hype yourself to say that you are going to cure everything. It is not possible. We can help the body to heal rather than we cure. Ayurveda doctor, please comment your views, sir. I didn't understand this question, Meghna T. In many cancer, Ayurveda treatment is utilized as a supportive treatment, whether this is a limitation of no. Limitation of Ayurveda, I don't think it is there. It's a limitation of us where we are unable to understand and implement those things. If you are able to give the results, people are ready to reach you out at any condition, but you need to have a documentation and approach them. So, in case studies whether allopathic and Ayurvedic medicine are taken together, yes, we can give the allopathic medicine and Ayurveda together. There are no issues, but we need to see where they are working. That is always required. For example, to say they kill the cells, we try to prevent the spread through the healthy cells to promote the health. But we need to see that contradictory should not happen. In case of you are giving some stambhana, they are giving some region. That should not happen. So in case of studies whether allopathic and Ayurvedic medicine is taken together it can be done. That depends on. So in case of studies, once again the same thing. How to prevent ulcerative colitis turning into complication. Ulcerative colitis, you need to go with the line of treatment which helps like Vasti, or initially we need to go with Pachana, Deepana things where that helps to normalize the Agni and then give the medication for the Rana and then Vasti. It depends on combination which you use. Up to which stage are cancer curable? Cancer is not curable at any stage. Because initially we say that initial stage is curable. That means it should not come back till his last breath. But if the causative factors are nullified, it is within the group of cells which are not spread to the secondary cells or to the whole organ or the adjacent organ. Then it is more chance of, because it's there, it's only in like Sanchaya Avastha of that area of Prakopa Avastha. Prasara is not done. Once it's Prasara, then the disease progress. But here you can see that when it's confined to a local area, it's more easy to operate that. And then you need to take Ayurveda medications where that helps to neutralize the microenvironment. This is very important. This is what we see that people after the operation or the chemo radiation, they want to detox. The word they use as a detox, but we are the perspective, we need to be in a position to give medications such that it can be neutralize the sakala, that is, which is causing the disease to the other. can we that radiation therapy reduces the lifespan of radiation therapy and chemotherapy? It's very difficult to comment on the open platform. Chemotherapy itself, it says that it's a cytotoxic. Cytotoxic means it kills the cells which are active apart from the cancer cells. So there are a lot of cells which are active like cancer, but they are not cancer cells, will also get destroyed, but definitely that will reduce the lifespan. In case of palliative care, definitely this is the area where we have a maximum scope in Ayurveda nowadays, because everybody will get treated with the chemo radiation therapies, and then at the end it is declared that the person is not fit for the chemo and radiation. Then the problem lies. What to do next? They will go with the oral chemo, which are less potent, but it is not effective. So maximum cases we are getting in this, because most of the time Ayurveda physicians are in the last in the queue. After seeing everybody, they will come to us where Roga Bala is more, Rogi Bala is less, and money is also less. So it becomes a difficult task for us to treat. Palliative care, usually what we're doing is, initially we go with a week to 10 days of medication, and then we change to 15 days, and then we go to month wise, and then we go to 3 months, 2 months wise. And sometimes if they have in between issues, then we treat accordingly. But investigations are required quite often to say that whether we are going on the right path. Sometimes the clinical signs and symptoms will give you an idea that we are going in a right path, but it may not be the actual one. Recently, we were treating one patient from Raichur who's having a lung cancer, but he was unable to sit for a while, unable to go to work. Now he is able to. But when you see the PET CT, which is done once again, we see that disease has progressed. But clinically, he is fit. So this is why opposite things which we can see also. But that will give you an idea that where you are going. But when you are doing the palliative care, you should be open enough to speak to the guardians that this is what we can help, this is how we want to treat. Not only palliative care, all the treatments which is required has to be in the same format, whether you are able to take it or not, because we are not experts and we are not claiming that we treat everything. I think most of the questions are answered. Is anything more?
Thank you, sir. Thank you. Thanks for clearing all the doubts, sir. It was really awesome and eye-opening session to all of us, sir. And it's heavy too. There is many more to learn about cancer, sir.
True, true.
And our
And even I was also a little bit fast so that it can be covered. Otherwise, usually presentation itself, and I have deleted more than 10-15 slides in between also. I had Nidana Panchakas also, but within a confined time, it is not possible. So I don't know, I could able to justify this.
it was very nice, sir. Very nice, sir. Our
Thank you.
heartfelt thanks to you, sir, for enlightening us on the role of Ayurveda in cancer. Your expertise and insights have been valuable, and we are very grateful for your time and knowledge, sir. Thank you for highlighting the potential of Ayurveda in supporting conventional cancer treatment, promoting holistic well being, and improving quality of life, too, sir. And we definitely appreciate your dedication to integrative healthcare, and we look forward for future discussion related to this critical topic and many more, sir. Thank you so
Sure,
much, sir.
sure. Thank you. Have a nice day. Shall we end?
Thank you. Yeah, you can
Welcome.
end, sir. Thank you so much, sir.
Okay. Welcome.